Perkins, I think we need to give that disc of yours a little more time before we consider surgery. You're making some good progress with your pain regimen, so I think we should keep that up and see how it goes.
Please, Doc. Call me Dwayne. Tell you, as long as you can keep me on those painkillers, I can handle anything. Ibuprofen was not getting the job done.
The night after you prescribed the hydrocodone was the first night of decent sleep he's gotten in ages.
I'm glad to hear that. But it does bring up an important topic. Certain medications like hydrocodone can be dangerous if you don't use them correctly. VA providers like myself are taking a step back and really evaluating the pain management options that we offer and to make sure we're providing the safest and most effective treatments available. One part of that initiative is a new program. It's called OEND.
What's that?
Opioid overdose education and naloxone distribution.
Wait, why would there be an overdose?
That's exactly what I wanted to talk to you about. This program was created for a class of drugs called opioids, which includes medication like the hydrocodone Dwayne's taking.
Okay.
Within the past few years, the medical community has realized that prescription opioids can be just as dangerous as some street drugs, and we just want to keep our veterans safe.
You're saying the medication you prescribed is dangerous?
Well, every medication has risks and benefits, and many can be dangerous if not used correctly. We talked about that when we first started his medication to help with Dwayne's back pain.
Isn't there something safer?
Alice, the more powerful it is for dealing with my pain, the more risk I'll have. Let's just hear him out, okay?
Accidental overdose is a very real possibility with prescription opioids like hydrocodone. Now, I'm particularly concerned about Dwayne because he has sleep apnea, which is a risk factor for overdose.
What does that have to do with it?
If a person overdoses, he or she stops breathing. Now, since Dwayne already has breathing problems, that could make things worse. When it comes to pain management, it's possible for a patient to be in such need of relief that they take more of the medication than they're supposed to, or to forget when their last dose was and take another dose too quickly. Or let's say that you decide not to wear your CPAP one night. That puts you at increased risk for overdose. Or if you decide to have a drink of alcohol one day, that puts you at increased risk. There are a lot of things that could increase your risk of accidental overdose. So it's important that you understand these risks and know what to do should something unexpected happen. Would you be interested in going over the details of this new program? It's not so different from an EpiPen or a fire extinguisher. It's just an in-case measure that could help keep him safe if there's ever an emergency.
Yes, Doctor. Would like to hear more about it.
Our program has two basic parts. One part is education. The educational piece teaches patients how to prevent an overdose and how to recognize and respond to an overdose should it occur. The second part is a kit that we send home with patients. The kit contains a medication called naloxone. Naloxone can save the life of a patient who's overdosed if administered in time.
I read something about this. Paramedics use it to save kids who get messed up on street drugs, right?
That's right. We at the VA have decided that it's important that we make the same protective measure available to our veterans who take opioid pain medications. Of course, the best thing to do is to prevent an overdose to begin with. And that's why we have a section in the brochure about that and what you can do to keep that from happening. This includes following the instructions for your prescription very carefully. Don't double up. Don't take too many within 24 hours. And you also need to make sure that you don't mix your pain medication with alcohol, drugs for anxiety and sleep such as benzodiazepines, or any kind of medication that might make you sleepy because those mixtures can increase your risk for an accidental overdose. That said, if something were to go wrong, we'd want you to be able to react swiftly. So let's talk about how to recognize the signs of an overdose. The most common signs of an opioid overdose include an especially deep and heavy sleep from which the patient won't awaken, even when you call his name loudly or shake him. Another is a very thick snoring that shifts to gurgling or choking noises. Because of the sleep apnea and the sound he makes, it's important to also focus on the other signs as well. It's particularly important to see if you can wake him up. Other signs of overdose include blue or gray lips or fingernails, or unusually pale or clammy skin. Any one of these symptoms or any combination of them could indicate a possible overdose.
So that's when I need the medication.
Yes, sir. We want you to administer the naloxone immediately. Then you dial 911, tell them your address, and that you have a person who is not breathing.
Well, how do I give it to him?
We have 3 different options, and to some extent, we like to leave it up to the patient as to which feels more comfortable. There's an intranasal kit, which is basically a nose spray, and there's an auto-injector, which has voice instructions and a retractable needle. And we also have an intramuscular kit.
Is intermuscular a code word for another kind of needle?
That's exactly right. It is a hypodermic needle that makes sure the medicine goes into the muscle.
Alice could do that easily.
I've been giving myself insulin shots for years now.
That sounds perfect. Could I set you up to meet with Kathy, our nurse? She'll show you a sample kit and make sure you're familiar with everything in it.
Well, I guess we better.
Yes, and thank you, Doctor.
You bet. Now let's go over the rest of this brochure before I send Kathy in. What I want you to take a particular look at is